Well, just be careful.
Yeah. Don't say anything untoward or, mildly inflammatory.
How will we know if people can hear us?
We'll find out later.
Okay.
We'll find out from Ezzy.
It's a little experiment. Yeah.
That's good.
All right, I'm hitting.
Okay.
Oh, nope. I'm pretty sure that we can hear our voices on the live stream.
Is that music going to continue the whole time?
No, I'm going to turn this thing off at 12 o'clock. I'm going to turn it off.
That's going to be very distracting for me if I hear that the whole time. I think I'll just kind of keep dancing in my little section here.
Elevator music.
I guess the next step is going to be to figure out how to take our voices out of the live stream.
I mean, I think you could just mute us. Like, I guess we can mute her.
But then we can't communicate.
And we can't talk to each other.
Actually, how about this? Let's try to see if we can also do Teams. So let's mute ourselves on StreamYard and then see if we can open the Teams account.
Okay, so I'm just hitting the microphone, I'm guessing.
All right, is that going to work? Can we simultaneously do this?
You want us to unmute, or am I supposed to be on a different platform now too?
Oh, I guess mine unmuted. Yeah, never mind. I tried to open a Teams thing, but.
Okay. I'm gonna have this little jingle stuck in my head all day.
Randy, do we need this intro music? No, I don't know.
Oh, just the same little tune just over and over again. Oh my gosh. Where do you possibly turn it off at? I have no idea. Got muted. Oh, unmuted me. Oh, thank you.
Can you hear me? Could you hear me before?
I can hear you.
Not before, I don't think, but... Oh, they can hear us. Can they hear the music?
We could probably just get started, Brandon. I think we
Here we
should.
go.
Okay.
There it is. We're started.
Oh my gosh.
Oh my
All
God.
right, everybody. Thank you for tuning in.
Oh,
Oh my gosh, Lisa, your hair is so long.
I know. I actually washed it today for the show. Brushed it.
Very nice. It's very nice. Luxurious. Indeed.
Yes. Yes.
Mermaid
Cool.
hair.
Well, welcome everyone to the live stream. I am Dr. Brandon VanderWel. We have Dr. Mimi Tan, and we have our very own Lisa, our patient coordinator. And today we wanted to talk about you're out there, you're struggling with your weight. You're like, I have tried everything, and I'm really need something. I don't want to live my life the way the rest of this, but I'm afraid of what the next step is. And this video is to help you have a discussion about, and you can also ask questions in the live, but to understand what this journey is like at the very beginning. Like, how do you even just get started with the journey and what to expect? So if you have questions, please put them in the chat. I think I'll be able to see them. We'll be able to see them on Instagram and on YouTube. And thank you for tuning in. So welcome everyone. All right, let's get started with the first questions here. So let's see. The first question, of course, if someone's out there and they're wondering, they're struggling with their weight, it's really holding them back, it's causing health issues. Their question number one is like, is surgery right for me? Dr. Tan, Lisa, what do you guys tell patients if they ask, should I consider surgery?
I'm gonna let Lisa go first. I
Okay.
think. Did we introduce Lisa? Did we introduce you? So I think we should
Let's
talk
do
about
more.
what Lisa
Let's do.
does
I
first.
said patient coordinator, but let's do a more thorough.
Yeah, I think that's what we should start with. Yeah, and then we can jump in.
So you want me to tell myself? So I'm basically the first person that you will speak with when you reach out, and that might be calling the office and talking with me. Maybe you are on our website and you send in a inquiry or a request for more information or to talk, and so you're going to get me. And we can communicate by phone, by text, whatever is best for you. And questions I get is, maybe you know that you have the benefit and you're ready to schedule, or maybe you want to know if you have the benefit. We can do benefit checks for you and find that out for you, or maybe you don't and you're ready to schedule and you want to know what the self-pay pricing is. So I can go over all those scenarios with you, answer any questions you might have about our program. I've been in the field for about 38 years, so I have a little bit of knowledge in me. So,
no, you're not even 38 years old.
I know. And so I always encourage patients, hey, if, there's no harm in just having that first consultation and having an opportunity to firsthand speak with the surgeon. And maybe after that consultation, you're like, okay, I've got more information now to kind of think about and research further, but at least you're getting it directly from a surgeon who has the most knowledge and not WebMD or whatever. So I always encourage people, and I always tell them there's no obligation whatsoever to move forward. There's no pressure. We are going to go over all the different options, and maybe that's medical weight loss, maybe that's surgical weight loss. So I just highly encourage, having that opportunity to spend time one-on-one with the surgeon to get their questions answered and get real good information and data. And again, with no pressure to move forward from there. And so, yeah, and then I always tell them that they will also meet with Trish, their coordinator, after. She has, I think, probably just as much, if not more, experience in the field as I do. She's amazing, and she will walk them through that process of, if I do want to move forward, what clinical items will the surgeon want me to do to get me safely to surgery? If I'm going through insurance, what's my insurance criteria? What do I have to meet for them to approve it? What does my financial pathway look like? What is my out-of-pocket estimate? And she'll walk you through all of that information and be your go-to person from consult to surgery if that's the path you want to take. So,
dang, that sounds like there's a lot of things there.
That was supposed to be just my introduction of who I am. That went into a lot more than.
Well, I think it's I think that just highlights, like, there's a lot of different moving pieces. This journey is very interesting. Sometimes it's very easy where it's like, hey, I'm struggling with my weight. I know I need something, and here, take my money. Let's go. I know this is going to work. It worked for my friend, that you did surgery on, and I know you guys are going to take care of me. And then that's a pretty straightforward one. Sometimes it's like, well, we got all these insurance hoops to jump through, and this and that and this and that. So, starting with that first question, Lisa's wonderful introduction, and we're very thankful that you're here. First question, I think, Dr. Tan, maybe you can start, and then Lisa, you can chime in about what your thoughts are as far as if someone is wondering if they should consider surgery. Who should consider surgery for weight loss?
Well, so, my very straightforward answer to that is that if you have excess weight, if you think you have excess weight, you should reach out. Period. Done. And that's why I think it's really nice that we have Lisa here today, because Lisa is really the first person from our clinic that people talk to, generally speaking. And I don't do those phone calls with you, Lisa, but I'm guessing there's a lot of anxiety. There's a lot of questions that people have. And if you are thinking about the fact that you maybe want to lose some weight, Lisa can go through so much of your initial questions and anxieties, because she's been doing this for such a long, you've been doing this for such a long time. And get a lot of those questions answered.
I think every question out there, and yeah. So, and most things I can answer, and a lot of things I say, I will reserve that question for your, one-on-one with the surgeon. More statistics and the data and things like that, I leave, for them. But for the most part, I can answer generally pretty much every question.
And I can tell from personal experience that Lisa will give it to you straight.
Yeah. Because it's first you ask the question of okay, do I want to lose weight? And if the answer is yes, and you want help with losing weight, then you should reach out to a clinic like ours. And then we can figure out what makes sense for you, whether that is surgery, maybe it is more medical weight loss. Do you have insurance coverage? If you don't have insurance coverage, what's the cost look like? There's all these questions that come after, and we can help you answer all of that. But it's just reach out, and just know that the first person that you talk to isn't necessarily like the surgeon, which is a little intimidating for a lot of folks. And so, you can get a lot of your questions answered right off the bat. And then you see us afterwards, and we can go into like the minutia of what makes more sense medically. Does surgery make sense for you medically as well? But my really simple answer is, if you are thinking about losing weight and you want help, call us or call a clinic like ours.
Yeah. So. If you're stuck and you're out there and you're like, man, I just even stuck with 20 pounds, like, we can have a conversation about how we can help you. You just you carry around a 20-pound dumbbell the rest, during the day, and you're like, this sucks. Can I get rid of this thing? So, like, just that, people feel like, oh, I should just be able to get my act together and things like that. And it's like, that is a part of this. That's a part of this journey that all of us can do better, and all of us have room for improvement. But at the same time, there are some really helpful biological tools, from medication to different procedures like an endoscopic sleeve. I had adventures with Allie, 22, just say like, yeah, best experience of the ESG with Dr. VanderWel, like lost 100 pounds. Like, that's awesome, Allie. Like, that's great. Thank you for reaching out and saying that. Like, these things can help people a lot, and you don't even have to be losing 100 pounds. ESGs are really nice for even losing smaller amounts of weight. There are lots of celebrities actually that have gotten ESGs because it's less invasive. It's very safe. It's, adding a little medication really helps you have that all locked in. So there's a lot of different tools that are out there. There's a lot of cool stuff that's available. Here's a good question, Lisa. Will insurance cover my surgery, and how do I find out if it will?
Good question. So you can always just call me directly, and I can gather your insurance information, and our insurance coordinator will do the benefit checks. You can also, on our website, send in an inquiry, and there's a place that you can upload your insurance card and your demographics too. And then same thing, our insurance coordinator will reach out to your insurance company and find out if you do have the benefit or not. And then I can go over that with you once those are completed. So yeah, it's easy peasy.
If someone doesn't have insurance coverage, what are the options that are available to them?
Self-pay. We do have our self-pay package pricing. Also, there are many employers out there that have the benefit. So we can provide you with, if you're maybe in between jobs or wanting to switch jobs, we have a list of employers that do have the weight loss surgery benefit. And that could be something you might want to potentially look into as, for a new job. Also asking your employer, your HR department, is this something we could, potentially look into adding at open enrollment?
Or is there even another plan that has it?
Correct.
We have a lot of employers around here where one plan doesn't have it, but another plan, a different plan does. So.
Yep, exactly. So when I tell a patient, unfortunately, you do not have the surgical weight loss benefit, I always say, reach out to your HR department, find out, is there other options within the company that might have the benefit? Or if not, then would they consider looking at adding it at open enrollment?
Mm-hmm.
So.
Yeah, because it's always a gut punch. I think that's the one thing that, like, that's the hardest thing about, I think, our field, is when there's so many people out there that want help and that want to move forward, and they just feel so stuck, and then that barrier is there.
Yeah. And they've reached out, and for the hope of help from us, and then I have to be the bearer of bad news and say, unfortunately, you don't have the benefit. Yeah. So yeah, that's probably the worst part of my job right there.
The nice thing is, though, that doesn't have to be the end of the story.
No, exactly.
It's just not that path. Yeah. That path isn't there open right now.
Yeah, exactly.
Cool. Well, thank you again for everyone that's tuned in across all the different platforms. Thank you for joining us. Next question, Dr. Tan. Okay, so you reach out. You schedule your consult, and you're really nervous, and you're like, oh my gosh, I don't know what's going to happen here at this visit. Are they going to grill me and tell me what a failure I've been my whole life? What is it like at the consult? what do you talk about with your patients?
Yeah. So our clinic, we do our first visits together. I don't think that's true for every clinic. Certainly some other clinics, you don't meet a surgeon until later in the process. I think it's nice that we get to talk early on in your kind of pre-surgical process, just so that we can get to know each other. The first visit, it's a lot. It can feel like a lot. Typically they're like 40 minutes to an hour. And it's because we go through a lot of information. I usually start off and just get to know your medical history. I want to know everything about you, what medications you're taking, surgeries you've had in the past, any hospitalizations, a little bit about, what you do and about your life in general. We talk a little bit about your weight as well. And that really helps give me some context in terms of, where you have been in the last couple of years with your weight. Have you been yo-yoing? Have you been steadily gaining? Have you lost a significant amount of weight before? Have you maintained? What have you tried in the past? And then we talk a little bit about your goals, what you're hoping to accomplish with surgery. And that's not just a number on the scale. I really like to hear about what your larger goals are in terms of weight loss. And then we talk about our options. I would say for most folks, the different surgeries that we offer, most folks are good candidates for all the different surgeries that we offer, I would say. But sometimes based off of something in your medical history, there might be one surgery that's a little bit preferred over the other. They each have their own pros and cons. And so we kind of go into the weeds with that a little bit, and then we pick what's the best option for you. And then we talk a little bit about stuff to do in the run up to surgery. And then I pass you off to our patient coordinator, who helps get things rolling. There's usually a couple of different things we need to get checked off before surgery. And so those are the things that we'll kind of get started on. But there's really nothing that you have to do to prepare for these visits, I would say. There's no reason to be nervous or anxious about them. There's really no grilling that is done. I would say the only thing is maybe knowing if you have a lot of medications that you're on, maybe having a list of your medications is helpful.
Very helpful. Very helpful. Yeah.
But apart from that, there's really not a lot to be done in preparation other than just bring yourself and we'll talk through everything. I have people who show up knowing nothing about bariatric surgery and what we offer. And then folks who have done a lot of research and know a lot and are very knowledgeable. And so we work through all of that together.
Yeah, it is. It's a wide spectrum of people that are like, I just did this on a wild hair thinking like I'm just desperate. And some people are like, literally, I've watched every single piece of content you've ever made.
Yeah.
Like, okay. But yeah, it is. It is. We try to make this process as unintimidating as possible. I always start every time with congratulations on just reaching out. It takes so much courage just to be like, I am going to take this. That first step is probably one of the hardest steps. And it takes most people 3 to 5 years to finally end up at that consult, from when they first plant the seed in their head that maybe I'm going to need something that next level, and to actually talking with someone in a professional capacity. So I always say, like, congratulations on just being here and just like taking this step for your health and for your life, because this is such a powerful tool and journey on so many levels. And then, yeah, it is like, what are your goals? What have you struggled with? What's your medical history? What's going to be the best tool for you? Because that's all these things are. They're just tools. They're not cures. They're not magic wands. It's not like, it's not like a, we take these tools seriously because they work really well and they're strong and they're powerful. But they do so well. They're very helpful. So,
I think I've been thinking about this a lot lately. And a lot of people, including myself and most folks, we're very good about thinking about our problems, thinking about what problems are, why these problems are problematic for us. And then it's really hard sometimes to shift that problem-based thinking into like a solutions-based type of thinking. And when you are like thinking about your weight, what do I do about my weight? What do I do about my weight? You are very much in a problem oriented type of situation. When you reach out and make that first phone call with us, you are shifting that into a solutions based kind of mindset. Because once you talk to us, Lisa's going to give you a plan on what to do next. And then you're going to see us and we're going to come up with a plan on what to do next. And then you just have to follow the steps and then we get you moving. And that's what's like really beautiful, I think, about this whole process is like we walk you through each of these steps and get things rolling for you, which is the hardest part. Reaching out is the hardest part. And once you do that, then we're on. We're on a roll.
Yes, it is.
Yeah.
Here's a good question. Lisa, you can answer this because you've seen so many years of all this journey. If someone has a consult, are they committed to surgery?
No, and I always tell them that too. If they're kind of on the fence and not sure, I always say, hey, there's no pressure. At least gather the information, get your questions answered, think about it more, talk to your family, and when you're ready, we're here for you. We're not going anywhere. So I always tell them this is a no pressure appointment, and so I think that makes people feel a lot better too. That we're not going to try to push it on them when they come in, and that it's just a great opportunity for a one-on-one appointment with the surgeon to get their questions answered and feel good about the next step.
Yeah, and I like to tell people, like, the person who is going to push you to surgery the least, if you're not ready for it, is us. Like, we do not, if you are not ready for this, if you are not invested in this tool, we don't want you on that table. We don't. Like, it's trouble for you. It's a lot of trouble for us. Like, you don't do as well. You're not as happy. Most of the patients in our practice come to us from other happy patients. And, if it doesn't do well for you, that's not a win for us. It's not a win for you. Also you might have more issues and complications, and it's hard to deal with those things. And it takes a lot of energy. And, all of us love this job because almost with so many of our patients do so well. Like, I honestly love my clinic days because you get to see patients just crushing it and doing an awesome job. And sometimes, there's things that are hard in life. That's just the way life is. But we always like really try. The more work you can do on the front end to set people up for success and not, anticipate the issues that you're going to have. We never want to push people into surgery. And we always expect that about 30 to 40% of people aren't ready to move on right away. They really aren't. So, and they may, at least half of those people end up coming back within a couple of years. Like that's very common. Like about 25% of the people we meet will probably kind of be like, just like there's something about this that's making me pause, and then they'll be back in 2-3 years. But we never want to push someone to surgery. We're the last people that are going to do that. Yeah. So but I do say, like, when you're ready for this, like, there's no point in waiting. Like, let's go. Like, because in 3 months, if you have surgery, if you can have surgery in 3 to 4 weeks, where you're at in 3 months from right now is an amazing spot. Like, it's really cool. Really, really cool. What steps do I need to do after the consult to get ready for surgery? Dr. Tan, what are there steps you recommend patients do? And then Lisa, in your observations over the years, the people that do really well with this tool, what are the things that they're doing and kind of the mindsets that they're in to set them up for success?
Well, I think one thing I hear from patients who is those that in the run up to the surgery, they will say, I've already started making the changes. I'm measuring out my, portion sizes that I'm going to be doing after surgery. People that are, already, they'll say, oh yeah, I've already, cut back on my caffeine or my pop, and I've switched to this, and are implementing changes before the surgery, and not like I'm getting my last hurrahs out, leading up to surgery. So the people that are already implementing those changes, especially after meeting with the dietitians, they're learning about what it's going to be like after surgery, and they start making those changes now and practicing and getting used to that. And those are the ones I think that you can tell, all right, you're going to do good. You're committed. You're ready. So that's just one thing I've kind of seen and noticed.
Dr. Tan, what do you tell people to do? Is there a couple things you're like, hey, if you can work on this from now when we meet to when we actually meet in the OR, this is really going to help you?
Okay. Yeah. Well, like logistically, the logistics, there's a couple of different things that we need to do, like lab work. You know, sometimes we get a heart tracing, sometimes we do an upper endoscopy, sometimes we get a sleep study. So there's like the logistical medical stuff that we
The
have to do
workup,
prior.
make sure you're
Yes.
safe for surgery.
Yeah. So there's some of that we have to do. I do have all of my patients work with our nutritionists, who are all wonderful, ahead of time as well. And like Lisa was saying, the people who are most successful are the ones who are the most serious about making the lifestyle changes that make you the most successful after surgery. And the earlier that you start with all of those things, the better. And so meeting with our nutritionists early on to kind of go over some of those guidelines, doing some of that teaching and enacting some of that is really helpful moving forward. I have everyone meet with a psychologist as well. That's not only required by your insurance usually, but I think it's also just a good idea. It's mindset is everything with this surgery. And so being able to kind of shift your mindset into the right place moving into this surgery is also really, really important. Like Dr. V was saying, we are not going to ever force someone onto the OR table with us, even if we could, which we can't.
Yeah.
But
it doesn't.
I want you to be as mentally and physically and emotionally ready for this surgery as possible before surgery. And so, you know, if you don't feel 100%, I don't feel 100%, and we're not going to do it. Little things that I ask folks to do. I ask folks to keep track of their weight prior to surgery. I typically tell folks, most folks, I don't need them to lose weight for the most part. Some patients, I do have a little bit of a weight loss goal here and there, just depending. But I typically don't want to see a lot of weight gain prior to surgery because that actually does make surgery quite risky for us. And so if that is something that people are struggling with, then we'll work on that together a little bit to get your weight back down. And then I think from an eating standpoint, the really important things to start working on as early as possible is really keeping an eye on portion sizes. You know, our program teaches a certain portion size with each meal. And so practicing that as much as possible early on is good. And then practicing tracking a little bit if you can. Tracking is a little tricky to get the hang of. And so doing a little bit of that is helpful as well. It's all learning. And then drinking fluids is another big one for folks who really like to chug water or gulp water and consume a lot of water at once. Sometimes we have to retrain how we're drinking a little bit. Yeah. So smoking, I want everyone to stop smoking before surgery.
Pretty much a universal doctor saying.
And then alcohol is good to cut back on as well. We do want you to be alcohol free for a few months after surgery too. So. And caffeine, also another thing to start pulling back on.
It's good.
Which people hate hearing, but it is. It is unfortunately a thing as well.
So my last question, I know we're kind of getting towards the time we wanted to be, is around, because our practice does the endoscopic sleeve and we have for 5 years plus now, I think, you know, patients that are out there that are like really wondering what options there are for her, they're not happy with their weight where they are. I don't know, in my opinion, in my, you know, in capacity now doing this for a long time, there's a lot of people out there that if you're considering a GLP-1, you should also be considering an endoscopic sleeve. Like the endoscopic sleeve has better weight loss results generally for those people, even when they're in the lower BMI category, when they don't have as much weight to lose. The chances of you losing the weight that you want to with the endoscopic sleeve and keeping it off long term, and actually price, like cost effectiveness, is a major, it really should be considered. And definitely, I mean, my encouragement to everyone that's like out there looking for what all the options are, at least know what your options are, because the endoscopic sleeve is a really great option for a lot of people. And actually, it's pretty interesting. Now we have a lot of patients that are on GLP-1s that want to get off of them and haven't been able to get off of them, that are looking towards, hey, what are my procedure options that I have available to me now? Because I don't want to be on these drugs for forever long term, or at least at the high doses that I am right now.
Yeah. No, I think it's good that you brought that up. You know, because I would say most folks who come see us haven't heard of the endoscopic sleeve gastroplasty. It's a pretty uncommon procedure that's performed. It's relatively new. And a lot of folks are interested in non-operative options. So they don't want incisions. They don't want to go under, all these different things, all these different concerns. And the endo sleeve or the endoscopic sleeve gastroplasty is a good in-between point for a lot of folks as well. So again, another reason why it's just good to reach out and chat with people who are experts, because we can go through all the different categories of options. I would say, you know, every other visit that I do, people are surprised by just some of the things that we offer and that we have available now. You know, the internet is a wonderful place, but it is also nice to hear from folks who do this every day. So
everyone is always surprised at how actually safe these procedures are. I think everyone's like, oh, wow, this is safer than and easier than getting when I got my gallbladder out, or this is actually safer than getting a hip replacement. Like, what was I so worried about? Yeah.
You know, it's unfortunate because a lot of what we see in like the media, on social media, and the news, it's colored by a lot of weight stigma. You know, all of this like
and extremes, you know, like as entertaining as my 600-pound and you know, and 1,000-pound sisters is, like people do like, well, I don't think I'm not that big, so I don't like, I shouldn't consider one of these surgeries. Like that's too far for me. I don't deserve that. And it's like, actually, it's just really helpful in the 21st century to have a smaller stomach. It's really, really helpful. I think everyone should have a 21st century stomach, which is a sleeved endoscopically or laparoscopically stomach. It would be really helpful for almost everybody. So,
yeah. So it's, I think, you know, we end up debunking a lot of myths oftentimes through our visits because there are a lot of myths out there. I have one more question for Lisa.
Yeah.
Okay. Lisa, what are some things that when patients talk to you that you surprise them with? Like, what are things that are unexpected that they don't know about the process? That
I would say probably how quickly and efficiently we get them in for their consult and to surgery. You know, they're always shocked when I tell them, you know, that's one of the biggest questions I get is how soon can I get in? How soon from consult to surgery? And I, you know, I'll base that a little bit, my answer a little bit off of, you know, are they insurance? Do they have a 3-month or a 6-month supervised diet? Are they self-pay? And I kind of get into their health history a teeny bit just to kind of get, and I'll say, okay, based on what you've told me, these are probably the clinical items you'll probably be asked to complete, you know, prior to surgery. So based on that, you could be looking at, you know, 4 to 6 weeks maybe and they're like, are you serious? I was thinking you're going to say a year, 2 years, or, you know, so that's I'd say that one of the biggest surprises is that, you know, we don't have a wait list like some programs do. And, you know, how quickly and we're able to, you know, get them in to have that initial visit to start the process and learn about more and talk to an expert and go from there. So that's always a big pleasant surprise. And then also that we can do all these visits by telehealth. That's another amazing one that everybody, you know, when I start and they'll say, okay, well, I can only do on these days, and I'll say, well, it's telehealth, so you don't even have to, like, oh my gosh, are you serious? And I say, yeah, for the most part, most of our patients only come into the office physically on the day of surgery, and that they're like, okay, you know, I'll schedule, and it makes it so much easier. So that's another big surprise is that they're very excited at it, how quickly, you know, we can see them and that we can do their visits pretty much all by telehealth. And then what else would I say? I don't know. I guess that's probably the main ones. And then also how soon they can go back to work after the endo sleeve. That's another one that, you know, when they ask, well, how long do I have to take off work? And I tell them with the sleeve and the bypass, typically 2-ish weeks, you know, around there. And then ESG, you know, oftentimes 3 to 5 days back. I always tell them, of course, your surgeon will review, you know, your medical history, job duties, and all this kind of stuff. I always
little disclaimer.
That, but I get them to say that your surgeon will answer these questions for you. But, you know, typically, you know, we usually recommend 2 weeks off, or oftentimes patients will go back to work 3 to 5 days. But I said, talk to them about what your job duties are, and they can let you know if that's realistic or not. But so that's another thing with the endo sleeve that they're pleasantly surprised. What is that noise? Pleasantly surprised about is that, how soon they could go back to work potentially.
Yeah, I just had a comment on my Instagram thing. I said, from Everyday Trey, had my ESG procedure in March with Dr. V, off type 2 diabetes meds and down 70 plus pounds.
Oh my
So
Jeez.
yeah. So no,
Yeah.
it's so cool how I don't know, it's just really fun to be in bariatrics, I think, and do these procedures because they work really nice, you know. And they're tools, they're not cures, they're not magic wands, but it is it's a really helpful tool, and it's very encouraging to help people move forward. And I think, Lisa, you're a great highlight of, you know, Aviva has you know, at every level that you're going to interact with, the people here, they really care. They're knowledgeable, they're caring, they're really warm, and they really want you to do well. Like literally, like all the people upstairs in the office that you will interact with at all the different levels, like, hey, how's so-and-so doing? Hey, how's so-and-so doing? They're always asking, they're asking us. They really care on how patients are doing, and they really want to see you do well. So
yeah, I always tell patients that too. It's just everybody here loves what they do, and we're going to be your biggest support and cheerleaders and fans and with you the whole way. So I always tell them that too. And I always tell them too how important our program is also because of our aftercare program. And I told them that over the years, the people that I've seen be not successful has been people who have gone to a center where they had the surgery and then that was it. They had no aftercare, no support afterwards to, and so I just tell them that's, you know, I think if not equally as important as the aftercare program as the tool. So, yeah.
awesome. Well, I keep having this like thought that I'm going to try to keep these talks to 20 to 30 minutes and every time. Yeah. But no, it's so great to sit down with you guys, and thank you for all the great comments in the comments here. So, oh, am I getting texts about it too? Yep. Nope, not about this. So, so cool. Well, thank you everyone for tuning in, and thank you for all your comments. We're gonna do. I got some patients lined up for next week. So, got a couple people going to be coming on. We're going to talk about the journey, what it's like. If there are people out there that are looking to ask questions or, you know, kind of hear real life stories of what it's like, please tune in. We're going to try to do a lot more, you know, just some patient stories about where they're at, the good. And I tell people, like, I want people to really understand, like, just be real, like the good, the bad, the unexpected parts, the parts that were harder than you thought, the parts that were easier than you thought. And, you know, because this is a journey, and we want to be here with people because we have dedicated our lives to seeing people's lives get better and their health get better. And I'll leave it with this one quote a patient told me a couple months ago. And he said, "This procedure has added years to my life and life to my years." So,
Oh,
yeah. Oh, cool. Well, thank you everyone for tuning in, and looking forward to hopefully seeing you guys on the next one.
I know. I look forward to talking to you all as well. So call me.
Yep. Sounds great. Thanks again for joining us, Lisa. And as always, Dr. Tan and everyone on YouTube and Instagram. Thank you for coming. Bye.
All right, bye. I don't know how to hang up. So.